Hello and welcome. I'm Holly Gerslin-Becerra,
And I'm Jenny Baldwin.
and we're the directors for the Preschool Development Grant Birth Through Five Infant and Early Childhood Mental Health Consultation Program through the University of Texas at Austin through the Texas Institute for Excellence in Mental Health.
We're excited to introduce our MAP series for our new Infant and Early Childhood Mental Health Consultation Program Manual. We hope this series will be helpful for consultants, organizations, and other interested parties to get a snapshot of the 4 sections of the manual as we work together to build an infant early childhood mental health consultation system for Texas.
We truly appreciate your dedication to supporting the mental health and well-being of Texas' youngest children and their families. Thank you for taking time to explore and engage with this valuable tool.
The Program Manual Map video series will walk you through each part of the Texas Infant and Early Childhood Mental Health Consultation, or IECMHC manual. The manual is intended to set standards for IECMHC services in early childhood care and education, home visiting, early childhood intervention, and pediatric settings, and seeks to build upon the existing IECMHC programs across Texas. We recommend using the program manual for the design and creation of new IECMHC programs, modification of existing IECMHC programs, and/or for establishing competencies for IECMH consultants and their teams. Orientation is the first of 4 parts of the IECMHC Program Manual Map brief video series and will be covered in this video. The orientation portion of the manual itself has 6 content sections as well as a glossary and references list. The introduction section of the orientation portion of the manual details some key concepts, including a description of the IECMHC approach, which also has a helpful figure called what, where, who, when, and why that describes the key components that IECMHC is grounded on. Another useful diagram, what IECMHC is and is not, can also be found in this section, as can an explanation of licensed versus licensed eligible, which summarizes licensure expectations for IECMHC programs. The consultant qualifications and activities portion of the orientation section of the manual details the qualifications of the highly trained, licensed mental health clinicians who are IECMH consultants, including the Texas requirements. This section also outlines the activities of consultation. There's a great figure here called IECMHC and the Early Childhood Continuum of Care, which explains promotion, prevention, assessment, diagnosis, and treatment. The impact of IECMHC and system building strategies are the final components of the orientation section of the Texas Infant and Early Childhood Mental Health Consultation Program Manual. The system building strategies section outlines key child, provider, and program outcomes from IECMHC. This section describes how IECMHC helps Texas to amplify and maximize its investment in other key programs, such as early childhood programs and behavioral health systems. A glossary is also provided for your reference at the end of the orientation section. This concludes the first of the 4-part video series for the Texas IECMHC Program Manual. Check out our next Program Manual Map videos, which will cover parts 2 through 4, competencies, training recommendations, and evaluation.